we would like to understand what is gut microme and how is a good gut the key to good health.
So our intestine has more than 100 trillion microbacteria. So these bacteria, they form a symbiotic relationship within our intestine. So we give them nutrition and in turn they give us good immunity and also some B12. Like B12 is not synthesized in the body, vitamin B12 is secreted by the intestines, the bacterial flora in the intestine, and that gets absorbed. So it's important to maintain this balance between the good bacteria and the bad bacteria within the intestine. So this entire flora forms a gut microbiome. So any infections, these microbiome gets disturbed and this causes the symptoms like diarrhea or constipation, excessive bloating, flatulence, acidity, indigestion. So all these are symptoms related to gut health.
Doctor, many people suffer from constipation. Now, what leads to this condition?
The most common cause is the change in the diet or westernization in the diet and a sedentary lifestyle. So there is no enough exercise to the body, so the gut functioning or the gut motility decreases. So how do we treat this? So one, take good amount of water. We need to consume at least 2 to 2.5 liters of water, that is 6 to 8 cups a day. Apart from that, increase the vegetable and fruits intake which has high fiber, so that high fiber intake and regular exercise, be it a simple walking 30 to 40 minutes a day. Exercise promotes gut motility. Along with constipation, if there is blood in stools, if there are black colored stools, if there is unexplained weight loss, severe pain abdomen or vomiting, all these suggest that there may be something abnormal in the intestines that is causing constipations. These patients needs to be investigated.
There is acidity, like there are people who eat very less but they have acidity and even gastrics. So why are people suffering from these kinds of situations?
So again, this is also a lifestyle disorder. Sedentary lifestyle promotes obesity, especially abdominal obesity. So most of the people say they are thin, they are not obese, but still they have this acidity and this. So it's the Asians, especially the Indians, tend to develop fat within the abdomen, not in the limbs. So it's called as visceral obesity. So that's the main thing that is responsible for all the obesity related complications. So whenever there is excessive fat within the stomach, that's increased abdominal pressure, so there will be reflux. So reflux may be because of multiple reasons. One is obesity, the other one is excessive caffeinated or carbonated drinks like drinking Pepsi, Coca-Cola and excessive coffee. So all this promotes reflux. So the reflux is basically the stomach secretes acid, that is normal, but the esophagus is very sensitive. So people will have excessive reflux of this acid into the esophagus that causes burning sensation or acidity or bloating. So the sedentary lifestyle, then excessive coffee or carbonated drinks, and alcohol and smoking definitely is an important factor, and obesity and diabetes, all these contribute to excessive acidity and reflux.
So are there any physical changes that may be indicative of a gut disorder?
So there is no specific sign that shows that it's related to gut disorder. It may be a generalized symptoms or generalized weakness or weight loss or bloating or not feeling healthy. All those things are indirect indication it may be related to your gut. So when we investigate, then only we can conclude that it is related to the liver or gut or any other.
Would you suggest some regular tests that people should take to know how the gut health is?
So if the patient or someone has the symptoms like we already discussed, then I would recommend the routine investigations, routine screening with a complete hemogram, liver function test and a kidney function test, a thyroid test and blood sugars. These are the basic tests, and sometimes we may order an inflammatory marker like ESR and CRP. So these overall give us a good picture whether there's any inflammation going on within the body or your overall health is good or not.